Today we're going to get to do what I call play, kind of like makeup. We're going to actually go into the operatory and see a patient and show you what a DVF looks like and how we do a wax up so you can actually see in your mouth exactly the way you're going to look by the end. And we're going to show you how your mouth has the potential to look in a healthy state. We've already gone through the issues with airway that you're having at night, and even during the daytime you've gotten some of that. So what I'm going to first show you is how far we would open your bite up. And we're going to be doing this by putting a little piece of wax between your teeth, and you're just going to bite until I tell you to stop biting. It's just soft orthodontic wax, and all I'm going to do is roll it into a little ball and ask the patient to go ahead and bite down as far as his musculature and his skeletal positioning allows. Right here on your premolars, because this is your balance position in your mouth, and it's a big tall piece of wax. Don't worry about it, it's not going to be that open. And then I want you to start closing down. Right there, stop. With him at this bite, you can start seeing he's getting a jawline, his lips are everting, his eye lines have gone away, and his nasal labial folds have gotten less deep. So what I'm going to do is I'm going to take this, which is just basically, we call it pink mashed potatoes, and I'm just going to squirt a little bit around the edges of the mouth. It's soft, but it's going to become a hard rubber. So if you can just hold your bite exactly where it is, and you can see that he has space between his teeth. And what we're going to do in just a moment is show you how we're going to fill that space. But right now we're just looking at skeletal structure, and we're looking where this wet dry line meets this upper wet dry line, which is where lips should meet. The front teeth are much longer than the back teeth, if you can see that. And that's really what we're going to do, is we're going to replace not only the wear on these front teeth, but the height that these back teeth should be. This is a genetic thing, that's not necessarily wear. So we got that side done, we're going to do this side now. But the whole object of this is to reframe your natural skeletal structure so that it is supported. This is the height that you're missing. And now if you were to look at your front teeth, and I'll give you the mirror in a second again, you can see the height that your lower teeth should be at. Okay? Now we have to fill in the back where all those other teeth are way too short. Okay? Here, so you can see where you're starting to get a cheek line, which you did not have earlier. It was just a round pooch, and that's because your framework of your jaw is not being supported. Also, you're getting an angle to your jaw, which will put less pressure on your teeth. Before, when you were closed, you were much more horizontal, which means you put a lot more pressure on your front teeth, which is why your front teeth are wearing so badly.
I immediately felt when the piece was in my mouth, obviously the mouth was more open, more oxygen, more air coming in naturally into my mouth. And when you have me sitting up on the profile shot, from the piece being in my mouth, my jaw being in its natural state, and then taking the piece out, I mean, closing my jaw, obviously breathing was different. And then almost like my neck, the back of my neck tensed up right away, just from the added pressure of closing my jaw. I felt a distinct difference just right back there. It was weird. It was,
what happens is that your lower jaw is the most free-moving piece of bone in your entire body, and is really not attached to anything except by all this musculature. This musculature of your jaw actually sets all the muscles that set your neck, which is why if your jaw isn't at the right position, your neck, it's C1, C2, C3 that it corrects. And the other thing is that yes, you are getting a much larger blast of air when you have that piece in, not only through your nose, because the tongue pressure is off the roof of your mouth and away from it, so you can actually draw more into your nasal sinuses, but also it opens up your airway because you're not crimped off. Because the reason you stick your chin out is you're putting yourself in a CPR position because you're not getting enough airway. So you're standing, and when your mouth is overclosed, the first thing you do is you try to put yourself your lower jaw out further so you can get more air, and what that does is it tenses your neck and it pulls it forward.